territories uh, of the Coast Salish, Tsleil-Waututh, and Squamish nations. And I say that not just as a matter of checking that off the list, but as an invitation for all of us to reflect about the colonial history of BC's healthcare system, and how, as health advocates who believe in a healthcare system that's there for all of us when we need it, that includes Indigenous peoples and includes having to say and address Indigenous specific racism in our healthcare system, which has deep roots in a segregated hospital system, and unethical health experiments done on Indigenous people, including children at residential school, and that translates today to worse access to care, stereotyping and racism, poorer health outcomes, and lack of access to cultural healing, and an imposition of colonial views of health. And so we can't address these things without naming them. And so I'll invite you to, take some time, if you haven't ever had a chance to take a look through the In Plain Sight report, and consider ways that in your own way you can address colonialism as a determinant of health. And feel free to use the chat to acknowledge the territories that you're joining in from today. So this is where we're going. We're going to do rounds, and we don't have too big of a group here today, which is nice because that means that we can get a chance to hear from everyone and know who's in the room. And then we're going to do two kind of teaching sections of how to do this. And in the middle, we're going to do a breakout exercise, which will get you in small groups, just talking and sharing for a little bit. And so that's the main part. We'll talk about, like how you take what you've heard in your house meetings and report back to contribute to the broader listening campaign of the Health Coalition. We'll talk about, what comes next. And then, as I said, we'll stay on the call for Q&A if you're interested in that, or you can hop off and proceed with the rest of your day. So house meetings, it's kind of a funny name. Mostly they don't happen in houses anymore, but their roots go back to the 1940s and 50s in, initially in California. A man named Fred Ross was organizing Mexican Americans and migrant farm workers, and would end up organizing with Cesar Chavez and Dolores Huerta in the United Farm Workers Movement in the 60s. And he really had this insight that people are already connected. People are already organized and have networks. And so if you're trying to build connections and power, ask people to bring their people together. And so that's what they did. And he would find this tool and kind of named it house meetings. But it's not exclusive to that movement. We know that Ella Baker, who's one of the key architects of the civil rights movement, before the civil rights movement really took off, spent years traveling through the Deep South in the United States and having one-on-one conversations and small group conversations and building small hubs of communities that were later going to be connected to this broader movement. And so that groundwork was really foundational to the power of the civil rights movement that came later on. And then we know also here in Canada, it's not a completely novel approach. Even before Saskatchewan had its first iterations of public health insurance, everyday people, citizens were organizing in farmers groups and churches and trade union halls, bringing people together to talk about their experiences with healthcare and what they can do together to improve access to healthcare. And so essentially, we know that that's the people power that made Medicare happen in Canada, and it wasn't just handed down to us from benevolent, decision makers and politicians. People believed in it, and people talked about it regularly in their communities, and that's what made the movement strong. So that's what we're trying to do again at the Health Coalition, is reconnect people and kind of make a discipline of having conversations about the public dimensions of our healthcare experiences. And so what's the purpose of house meetings? There's a few purposes. The first one is to unearth stories that call for change. We'll talk a little bit more about stories today, but we know that people learn through stories, people build relationships through stories, and stories can be a strong motivator to action. And the other purposes are to build relationships of trust and understanding and connect with community leaders who have appetite for action. And so when we're doing these house meetings and we're doing this listening season, we're not just looking for the stories. It's not like we're just collecting data. We are also looking for people who want to work with us, who want to take action together. And by the process of listening to these stories together, we're able to identify issues of common concern, and that will help us as a coalition set some campaign priorities in the next year. It's really foundational work. It's radical in the sense that it's the roots of what we'll be doing. I'm going to hand it over to my colleague Usman, who's going to talk a bit more about team roles and logistics, and then some guidelines to help you think through before you have these conversations.
Thanks, Audrey. So yeah, we have this grand idea of why we want to do house meetings and the purpose of house meetings, and now you might be wondering, how do you actually do them? So we have a listening toolkit where all this information is written out and it's available, and we'll make it available and share it with you folks afterwards. But just to speak to first the team roles that you'll need to pull off one of these house meetings. The first and I think most important role will be the leader role. And so the leader is the person who holds a space, who facilitates the space, brings people together, and really does the job of creating a space where folks feel comfortable sharing their stories, and bringing people together to do that. The other role that's an important role is the note taker. Now, ideally, the note taker should be a separate person from the leader. The leader will have their hands full facilitating the space and making sure it's a space where folks feel comfortable sharing. So the note taker will take notes from the stories, and what we're hoping is that the note taker actually then communicates those stories to us through a report back form, which we'll put in the chat, and it's also the link to it is part of the listening toolkit that you'll receive as well. The other two important roles are a host role. Now that can the host can really be the leader or the note taker. It doesn't need to be a separate person. I think in some cases where you're organizing an in-person event, it might be nice to have a separate person take on the host role. So this is a person who's making sure the physical space is set up, there's snacks available, people know where the washrooms are, things like that. But certainly, like, the leader can do some of those roles as well. And then the fourth role is a support person role, and that again can be a role it doesn't have to be a separate person, although it is nice for that to be a separate person, but it could be the leader, it could be the note taker. But a support person really is the person who is sort of doing an emotional temperature check of the room. We recognize that folks sharing their stories, particularly healthcare stories, that there's an emotional component to it, and our stories are precious to us, and so the support person really is a person who's keeping track of the emotional state of the group, checking in with the group, checking in with people one-on-one. That might happen, that might even happen like if someone after sharing their story is feeling like they want to keep talking, but there's not space in the group to do that, the support person can pull them to the side and have a one-on-one meeting with them, in a physical space. Might be a bit harder to do virtually, but the idea is that the support person is really helping the leader facilitate the space. The other role or the other responsibility of well, actually, okay, I'll just stop there because go ahead, Audrey, go to the next slide. So I mentioned some of this already. The host or the co-host organizes the date and location of the house meeting. They invite participants, make sure they're welcome. yeah, and advertise, a time and location to a broader audience. They're really the person who's like, who's bringing the space to people and making sure people are comfortable in the space. But that, like I mentioned, they could also be a note taker. They could also be a support person. So there's many roles. So the leader, which is, I think the most important role, leads the conversation. They, explain the ground rules of the meeting. They go through the agenda. They introduce the questions being discussed. And I think this is the hard part. They ensure that everyone gets a chance to speak. And that might mean actually actively intervening to make sure people stick to their time limits. That might mean sort of being like, being a bit forceful in making sure that people are stepping in and stepping back when they need to, and making sure that everyone has a chance to share, particularly particularly by participants who come from marginalized communities. So, the leader should be thinking about how do we create a safer space for participants whose stories aren't usually shared, who might have, other might come from equity seeking communities, might have other kind of social aspects of their social identity that would be good for people to hear from. Go ahead to the next slide, Audrey. Note taker. So as I mentioned, the note taker really records the main themes of the conversation. What we're not looking for is like word for word, like a recording of word for word of people's stories, but really it's the main themes of the conversation. What type of stories, what are the interests and issues and themes that surface, as well as like more logistical items like who attended, and and potential leaders, like who was really fired up speaking about their story, and or who raised their hand at the end of the meeting to say, I am interested in organizing one of these house meetings for people in my community, or around my neighborhood, or in my parents group. So making, noting those people's names down, and communicating that to us through the report back form. The support person is, like I mentioned, the person who's providing the emotional and practical support when it's needed. That might happen in the form of one-to-one emotional support. That might just be being present in the space to hear participants' stories and experiences. And then I think a big part of what a support person can also do is really assist the leader in making sure that participants who self-identify from equity-deserving groups have a chance to speak and be heard. I noticed someone from the group mentioned they work with newcomer communities. So, really the support person would be the person who's working with the leader to make sure that are the newcomers in the group, are their stories being shared? Do they have a full chance to speak, and to intervene if things are happening where they're being cut off, or people are starting to kind of diagnose their issues, so to speak. So some points around logistics. You'll want to think through as a leader, or maybe as a host. You'll want to think through what format you want to have the meeting in: virtual, hybrid, physical. How do you sign people up? Do you promote it widely through your organization? Is it a personal invitation? We know that the best way to get people to show up is really that one-on-one connection, that personal invitation. But that's not to say that there's no role for promoting widely if you have a group that you want to invite, or you're part of a group. And then thinking through questions like, if it's in person, do we offer refreshments? Is the venue accessible? And then recruiting some of the other roles I mentioned, like note taker or emotional support person, and thinking through who can I ask to be in those roles, and thinking about, when do I want to schedule the meeting, and date and time of the meeting. Next slide, please, Audrey. So some general guidelines. Now, we're happy to support and offer more advice, and certainly all of you bring your own experiences potentially as leaders. But these are just some general guidelines that might be useful for you to think through. So first is that as a leader, you're asking for permission to interrupt and inviting new voices to join. And I mentioned being part of being a leader is really being actively involved in the conversation, being actively facilitating the conversation, and that might mean you need to interrupt at certain times. Another group guideline is to focus on stories and our own lived experiences. So again, the leader should be comfortable intervening when people start rambling or generalizing or talking about a community that they're not a part of. And then, another group guideline we want to suggest is for people to share only what they feel comfortable sharing and to honor each other's stories. So, I was mentioning, we don't want to get into a space where we're fixing people's problems or diagnosing their issues. I think there's value in just listening and honoring each other's stories. And then the note takers will be capturing broad themes, and like I mentioned, they won't be recording stories word for word, and no one's stories will be shared publicly without permission. So that is a good group guideline to make clear and to repeat, so that people feel comfortable sharing their stories, their vulnerable stories. Another group guideline is that, and this goes back to the, how do we create a safer space for each other? What we're suggesting is that a guideline be, we are all responsible for creating a safer space for each other. And that might mean the leader spends some time working with the group at the start of the meeting to create a group agreement or a community agreement. And some things to consider in a community or group agreement could be guidelines like step back and step in, which is, if you notice yourself, you're speaking lots and you're sharing lots, for people to self-identify that and just step back and let people who aren't speaking up share. And similarly for people who are not sharing, for them to sort of step into discomfort and share their story. As long as it is, a safer space for them as much as possible. I mentioned this already, but another community agreement is avoiding solving another's problems or engaging in therapy or diagnosing or workshopping a situation. So again, we want people to actively listen to each other's stories, so that's another good group guideline or community agreement to potentially have. But these are just some suggested community agreements, and perhaps the group has other agreements they'd like to make. So again, that's something that we encourage group leaders to spend some time on. The final group guideline is really to be respectful of each other's time. We have a limited set of time, so that's good to remind people that we need to be firm on time limits, and the leaders' responsibility is really to keep to those time limits and make sure that we're not spending too much time hearing everyone's story. Sorry, go ahead. So tips for group leaders. Go ahead, Audrey.
Go for it. Sorry, got confused. No, you. I think I'm next, but go for it. Okay. Sorry.
So tips for group leaders. Again, this is an important job, important position, and so these are just some suggested tips. You might know others as well in your own facilitation, but give everyone a moment to reflect before sharing. Silence is sometimes needed for people just to think about what they want to share and to start, articulating their stories in their minds. Excuse me. Invite different voices to begin each round. You don't need to necessarily go in a circle or make sure everyone is part of sharing. We want to give people an opportunity to share and make sure everyone has that opportunity, but doesn't necessarily mean we need to go one by one. And then And then to keep an eye out for anyone who might be from a community that's made marginalized. That could be newcomers, that could be migrants, that could be uh, people of color, that could be people, indigenous folks, on reserve or urban indigenous folks. So really thinking about how to, paying extra attention to what they say, and for the note taker to make sure the themes they're bringing up are reflected in the notes, and what they're and summarizing or reflecting back their story for the leader is a good way to show that you've heard what they're saying. And then, of course, as with any community, community sharing, we'll have participants who are, difficult, but let's say they're passionate participants. But as a leader, this is where you'll want to intervene at certain times, and of course, it's good to be polite, but you want to be assertive in pulling the conversation back on track. That might mean intervening or interrupting a couple of times before they finally catch on that the conversation needs to be brought back on track. Rescuing the group's experience by communicating why you decided to move on. So this a great example is just saying, "I'm going to jump in because we want to make sure we have enough time to hear," or I can tell you have lost your think. You've thought a lot about this, but we want to stay rooted in our own experiences or the experiences that are relevant to our own identities, as opposed to talking about someone else's experiences. So we want you to be assertive in pulling the conversation back and making sure everyone, the house meeting is a valuable experience for everyone.
I think that's me. Thanks, Usman. So just really briefly, because we want to give you some time to get into small groups and share with each other, but really storytelling is the heart of all of this. And as we mentioned, it can take a lot of courage and trust to share an intimate story. And the reason that we do it is because personal stories often have a public side. Our stories don't happen in a vacuum. We learn a lot about the patterns in our systems through these firsthand accounts. And it can actually be quite quite a powerful feeling to realize that, oh, like it's not just me wrestling with this, like this is a shared issue and we could actually come together and do something about it. So storytelling, it helps us to connect to each other, build community, and find common cause to organize. And really people learn from stories, not from fact sheets, and so that's another reason why we share. And all of this is, like it's kind of a show don't tell situation. If I tell you that it's really powerful to share stories, that doesn't mean much, but if you get a chance to share stories with people, you might realize why they might be powerful for you. So the next thing I want to do is go a little bit more detail about what actually happens in the house meeting. So we'll go over the agenda, and then the discussion questions. And again, this is all included in the listening toolkit that we'll make available to you, and we'll make these slides available as well. So if it feels like I'm going over this a little bit fast, I hope that the information is accessible in different ways. But basically what you want to do when you come together, start with a welcoming and a land acknowledgement as is appropriate to where you live. I would suggest like right away just doing a quick round of introductions, so that people have that sense of like breaking the ice early on. And then the leader wants to go over the purpose and the overview of the agenda. So tell people this is why we're here today. We're participating in this listening season and trying to hear stories of people's experiences with healthcare. In the listening toolkit, there's a much more detailed suggested script that can help you kind of communicate the purpose of the meeting. So I'll let you kind of review that and as you prepare for your meetings. And then you want to go over the group guidelines, as Usman talked about, so that people are kind of engaging on the same terms and aware of the kind of tone and pace of the conversation. And then once you've done all of that kind of like groundwork, you want to jump into the questions. So there's 3 main questions that we want people to discuss. And then there's 2 kind of closing questions. One has to do with people's commitments and what they want to do coming out of this conversation. And then the closing round is just, once a summary of like, what are you taking away? So here are the questions. There's 3 questions. They're broken down into a story. You want to give people a chance. Oftentimes, starting with that personal story is, that's the easiest. Well, not necessarily easiest, but that's a more personal way to start. So share a story about a recent encounter with the healthcare system. And then move into people's sense of what's the problem. What are the most pressing issues facing you and your loved ones when you need these different categories of care? And people might say, like, my emergency room is closed at 5 p.m. What happens if it's 6 p.m. and I need care? Or I don't have a family doctor? Or, I was charged $700 for a test. So those kinds of things. And then bring people to thinking about some solutions. So thinking practically, what would make the biggest difference? And I would encourage you to help people think really concretely here. It's easy to say, it would be helpful if the federal government gave the province more funding. But we're trying to get something, closer to home. Like, it would be really helpful if, like, there's no doctor in my community, but maybe there was someone else available that could, that could be there while we're working to get a doctor in the community. So thinking like really creatively and like on the ground. And so, the bulk of the agenda, 45 minutes to an hour, would be discussing those 3 questions. And then what's really important is to save at least 15 minutes to really help the group think together about what some next steps might be. So it's kind of a placeholder question in there about, in light of this conversation, what are you prepared to do to bring about the changes you'd like to see? So that's an open-ended question, but oftentimes in my experience, people need some prompts, so ideas of what are some options of things to do. So right away, you can invite them to the action planning town hall, which we're organizing for April 23rd, and anyone who's participated in any House meeting in the next 2 months is invited to join that action planning town hall. It'll be online, and it's a really exciting opportunity to hear report backs from like all of the themes of all of these House meetings that have happened, and so it can really help people feel like they're part of something bigger, and then they get a chance to identify what feels like a priority for them. So it's being part of this broader process of building power together. But then we also have a commitment card, and you can feel free to like print it out if it's an in-person thing. It's a Google form right now, so you can make a link available to people in the chat if you're doing a virtual meeting, and just take some time to go over it. There's a few different sections. We're asking people to think, can you bring some people together and have a House meeting of your own? And then we're developing a couple of workshops that would dive deeper into the problems and the policy solutions for some of these things that we know are commonly experienced. So that's another option for people like, I want to learn more, I want to get involved in building some towards some solutions. And then we have a bunch of other options. So this is really helpful for people to think about different ways that they could take action based off of the conversation that you had today. So great to have a chance to go over that, give people a moment to think about what they might want to do. And then if you have time, invite people to share what they want to do next. And then just as a nice way to close off, our suggestion is to just, make sure everyone has a final chance to be heard by sharing one key takeaway in a word or phrase from the conversation today. So that's, just one option for how to wrap up, but we can leave that also to your discretion. So once you've done all of that, and the people, the guests and the participants have, you're closed off, what you want to do is everyone who had a role, so the leader, the note taker especially, and then if there's a host or support person involved, just take 15 minutes to have a quick debrief together. and think about, were there any issues that particularly resonated with this group? Were there any really powerful stories that the group really gravitated towards? Like if oftentimes in the group, one of those stories will like really kind of become center of the conversation for a while. And so that's a powerful story. You want to note that. And then are there any people who stood out that would be interested in taking a leadership level role, or taking a next step, and someone that maybe the Health Coalition staff could follow up with and help them get involved. And we do have a separate form that we're asking note takers to kind of fill out and submit after the group. So just to be quite clear, there's 2 Google Forms and two different links for you. The first one is the commitment card that you want to share with the participants in the group. And then the second one is the report back form. And that's for the group leaders and the note taker to help us at the coalition kind of keep track of the key themes across the board. And then I just really briefly want to give you a sense of what happens with that. So the listen portion is now to April. So this is a season that we're trying to intentionally set up these house meetings. And as I mentioned already, we're having on April 23rd an action planning town hall where all of this comes together. And that will be the basis of a Vision for BC Healthcare platform that the Health Coalition will develop to use in our elections campaign. So it's a nonpartisan, evidence-based platform of solutions that would improve our public healthcare system. They'll be rooted in the stories and themes that come out of the listening season. And so you can feel free to help people understand this is the process, this is the work that they're participating in, but also for you to know, please come to the action planning town hall so that we'll report back on what we're getting in terms of themes, and you can tell us, does that resonate, does that land, did we miss anything, and be part of this greater work of building a power base for strong public health care. So with that, look at that. It's 2:00, right on time. I want to ask everyone if you were willing to take a moment and use the chat to give us a sense of like kind of where you're at. You can also hang out. We'll stick around for question and answer, but please, if you can take a moment, if you need to kind of leave, I know it's 2:00. Put it in the chat. Who, where, when are you thinking of organizing a house meeting? And then are there any additional supports you need that we didn't cover here today? If you don't want to put that for everyone to see, feel free to send it as a direct message just to me in the chat as well. And you can always email the Health Coalition. We're really we'll be making ourselves available over the next 2 months to support anyone who wants to do this. So really happy to organize a phone call or a Zoom call with anyone to think through how this is happening. If it's especially if it's a virtual one, it's really easy for us to join and help out with one of the roles if that's something that would be helpful in making it happen. So please don't be a stranger. We are really excited to work with you to do this in the next little while. So with that, thanks everyone for joining today. And as I said, you're welcome to stick around, and we'll do kind of Q&A or workshop any questions you have.